nutrition is really, really, really broad, and there's so much to learn about nutrition, and there's so many different diets that people get confused. Am I supposed to do the Mediterranean diet or the Dutch diet or the whatever diet? So when I was doing primary care a long time ago, I did a weight loss practice, and I got to the point where when things are getting confusing, I would just tell my patients, when you want to eat something or drink something, ask yourself one question: is that the way God made it? If it is not, then you need to step back and look at what you're trying to eat or drink. So when you apply that philosophy, when you go shopping, you get to the fresh fruits and fresh vegetables aisle. This is the way
on, moving over here, the change in diet, the change in, lifestyle in general already predisposes you to a lot of stuff. Many people are not aware of that. Yeah, let me stop there.
As I introduce myself, I am a priest in the Episcopal Church. So I will give some reference to the Bible if you don't mind. Talking about faith in preventive care, I strongly believe that as pastors have so much to do when it comes to preventive care. Because when people come to church, when we preach, people tend to take many of the things that we say, and they also tend to believe many of the things that we say. So if you happen to go to a church of a pastor who does not believe in preventive care, you will most likely hear sermons against preventive care. You will go back home with the notion that I am not supposed to do preventive care. And when we preach, all the time we tend to tie our sermons with the Bible. So if I'm a pastor, I don't believe in preventive cares, I'll come up with a sermon and Bible scriptures with my interpretation which support not going for preventive care. So people in the church, we believe so. I can give an example. When COVID hit in 2020, I'm from Tanzania. Majority of Tanzanians did not get vaccine, which is part of preventive care. And the president that we had back then, unfortunately passed away. He was also against vaccine. And guess what? The government officials and the pastors used the Bible to argue against COVID vaccines. And many people died back then. So I'll say we pastors have a lot to do. And in addition to that, I believe we pastors have to educate ourselves more about preventive cares so we can be able to take care of the people we serve. Going to seminary, I believe, is not enough to be able to be educated enough to teach people about preventive care. Most of the time you will sit and hear sermons, someone preaching against, say, therapy, which is also part of preventive care. Like we always will preach like all you have to do to succeed in this life and for you to be happy, you have to pray. You have to pray and pray and pray and pray. Yes, I believe in prayers, but I also believe in therapy as well. I hear lots of people when they come for counseling, when you hear their programs, you recognize that this does not need prayers. This person needs somebody who has expertise in counseling for them to go to talk with. But it depends whether I, as a pastor, believe in preventive care or not. So I believe it starts with pastors. And I strongly believe when it comes to faith, we have to do preventive cares. I will finish with an example from the Bible. Jesus himself, as a person whom we look up to, we hear so many times in the Bible, he went outside for himself. Sometimes he was with a crowd. Sometimes he was with 72 disciples. Sometimes he was with 12 disciples. Sometimes he was with 3 disciples. And sometimes he was alone. Sometimes we need time for ourselves. Thank you.
Has no financial gain whatsoever. And all these industries, they exist to make money. So the onus is on you as an individual to seek that education and attend programs like this. If I will, the model you talked about, the healthcare outreach, that's what I do when I go to Africa. We take medications, we take volunteers, and we not only educate, we also do consultation and we give them medications. But those only go so far, you know, they only go so far because you're there for what, 10 days, you see patients for a week or something like that. And every time we go, we see more than 1,000 patients every time we go. But at the end of the day, you're gonna pack your bags and you're gonna go back home. And then what happens when you leave? So I do have another program coming up next month at the City of God, RCCG Church, City of God, in Maryland Heights on August 23rd. And it's gonna be, we're gonna start out with something similar to this where we do health education, and then we'll break out after that to do health screening where you can check your blood pressure, check your blood sugar, you know, basic things that you feel you want to do. And we're gonna have specialists there too if you need counseling, if you have questions about something. We're hoping to have enough doctors to kind of cover different specialties so that we can do like...
Me, myself being from Nigeria, I remember growing up all of these things, so let's pray it away. You don't need medicine, you don't need to see a doctor, you don't need therapy. So it's so important that you say that because you can do both together. Exactly. One does not cancel out the other. So that's important. And unfortunately, a lot of people died during COVID because of that misconception. So before I get into the next questions, I just want to use this as a moment of teaching. So if you can each tell me what preventative care looks like to you, what should people be doing preventatively right now? So Dr. Jones, you are in the hospital. What do you tell your patients? What should they be doing prevention-wise?
So, unfortunately, that is a very, very long-winded question. But I'm gonna do my best to give you a summary because, like I said, preventive healthcare is really, really broad. But I believe so much in education because I believe that the foundation of preventive healthcare is health education. When I take his example of praying, pastors talking against the COVID vaccine, during the time of COVID, there was so much controversy. Even my own brother was calling me, was refusing to take the vaccine, and I, as a physician, had difficulty convincing him that this was the best way to go. So at the end of the day, it's all about educating yourself. I cannot teach you everything you need to know right now, but I can tell you that there are so many engines out there on the internet. And the other caution is when you go online to look for information, go to the proper place to get information. There's a lot of places out there that's gonna give you their own opinion, but you want what we call evidence-based information. So you go to the proper place to get your information. There is that phrase, you are what you eat, and it is 100% true. You are what you eat, and it affects so much in your body, in your system, in chronic diseases, chronic illnesses. Things that we do to relax. People who relax can't relax unless they smoke. How much you smoke, how much you're drinking, the types of the things you put in your body goes such a long way with your health. And then you go all the way to screenings. There's so many different things that we screen for, and we screen for those things for a very good reason, because they have done all kinds of studies. Statistics have shown that it is less expensive for you to do this test, to rule this out or detect it early so that you can start the treatment early, and that increases your chance of actually getting to a cure. You're a breast surgeon, so with breast cancer, we'll be making sure when you get to the right age, when your parents are the right age, that they're getting regular mammograms, so that those things can be detected early. And there's so many things that we screen for. I can't go into all of them. You know, there's other things like immunization. We talked about the COVID vaccine, but there's so many other vaccines out there, and they're there for a reason.
And what I always told patients back then was, you don't have to wait till you have symptoms before you come to the clinic. Usually when people come, they often already have some symptoms, and they're already on the path to complications, So just being aware that if you do wellness visits, that's something that we're not used to, because we interpret healthcare as
Lancet paper published like I said 3 days ago. It says just about 7,000 steps we need. In fact, from 3,000 you start to see the health benefits. So just making those walk, those putting in those steps is already preventive medicine in itself.
Thank you. Good primary care physician and a good pediatrician. Almost all the computerized system produces and automatically generates for what age, what type of screening, what type of preventive care should populate. So using your primary care physician or your family physician office regularly will make those preventative cares to be updated and be on the lookout. In my practice, mine is sleep medicine. So I screen people. Then primary care physicians also are supposed to screen for sleep apnea, insomnia, and good sleep hygiene and everything else. But after they come, we screen for sleep apnea, restless leg symptoms, parasomnia, or acting out in their sleep, and primarily young people having this circadian sleep disorder.
Just individually, we need to routinely introspect and see where we are falling behind on that mental health spectrum, because usually we tend to defer it. Like, you want to be strong for your people, you want to be strong for yourself, you want to be strong for your family, so you don't take those things seriously. I just want to double click on some of the points you raised, especially the issue of underinsurance. Many immigrants are faced with so many issues, trying to settle in, picking up underpaid jobs, instances where that you're giving your all, but the kind of insurance that
child, they will rate the child that you may not like when they grow up. or when they become teenagers. So I believe it starts from home, and it starts with the parents themselves. And to be able to do that as Africans, as I said before, we may be out of Africa, but Africa is still inside us. That means we need to educate ourselves more about those cultural things that have come with us here in America, to be able to educate ourselves more about mental health and to preventive cares, so we can instill in our kids the good cultures and good things that we want them to grow up